Hello friends, welcome to English Shorthand class. Ready? 1, 2, 3, start. Second, the government should focus upon developing science and evidence-based case identification and treatment plans which are strictly adhered to by both public and private healthcare providers. Some of the policies on testing, isolation, and hospital discharge have already been revised recently. However, there is need for further revision in admission policies and clear articulation of the contact tracing approach. Adherence to the latest official testing, admission policies, and treatment guidelines should be ensured through effective monitoring and better enforcement of healthcare regulations. Third, every effort should be made to continue economic activities. There is very limited relevance of any type of COVID-19 curves, with the only exception being large public gatherings in which physical distancing is not feasible. The essentials such as elections, etc., can still be planned in a calibrated manner with stringent adherence to COVID appropriate behavior. Fourth, the infodemic continues to be a major challenge in this pandemic. It is never too late to mount a credible, timely, and transparent science communication from trustworthy sources. This approach should continue till the COVID-19 pandemic becomes endemic. The number of new infections in the ongoing Omicron wave might have been very similar to previous waves driven by the Alpha, the Beta, or the Delta variants. However, there is sufficient epidemiological evidence to conclude that Omicron does not cause severe disease, at least in fully vaccinated individuals. It also means that while responding to the ongoing surge, it is time to get future ready and prepare for COVID-19 endemicity. The most important step would be to use the data on COVID-19 infection, hospitalization, deaths, as well as clinical and vaccine-related aspects, which should be analyzed proactively. That would help in answering pending policy questions and decide and plan evidence-informed strategies. The new scientific and epidemiological understanding should be used to ensure that social and economic activities return to normalcy. To facilitate the process, there has to be a renewed focus on improving ventilation of especially indoor spaces and effective public health communication for calibrated COVID appropriate behavior commensurate with the local COVID-19 transmission. The governments should consider incentives to increase adherence to COVID appropriate behavior and explore public subsidies for masks, including provisions for free mask distribution. There is a need to ensure that non-COVID-19 essential health services are not disrupted in any subsequent surge of COVID-19. Testing is done in a targeted manner for high-risk populations. Genomic sequencing is optimally used along with setting up of wastewater and sewage surveillance for tracking SARS-CoV-2 transmission in communities. Alongside countries that are having a surge of Omicron should not be in a rush to introduce booster doses for healthy adults or to vaccinate healthy adolescents or children. About schooling, there is sufficient evidence that children are at lowest risk of poor outcomes of COVID-19. However, arguably they have been impacted the worst by the pandemic because of disruption in in-person schooling. Therefore, the focus of every country and society has to be on how to keep schools open. Schools in Indian states should be open urgently. In any future COVID-19 surge, schools should be last to close and the first to open. One of the biggest learnings from 2 years of the pandemic is that all countries need to strengthen primary health care systems, which could become the fulcrum of the COVID-19 response in the post-pandemic period. The pandemic response strategy should be revised to ensure that the majority of infections are detected and COVID-19 cases attended at primary healthcare facilities which are closer to the people. In fact, the proportion of all COVID-19 cases detected and managed at peripheral facilities could be a performance indicator of the healthcare system. The pandemic should be used as an opportunity to train and retrain and empower general physicians, family physicians, and primary care providers in every setting. The post and long COVID conditions as well as mental health and school health need to be given renewed policy attention. No royalty status, please. It is more than 2 years since SARS-CoV-2 was first detected and reported. It was a novel virus then, but not anymore. The world knows a lot more about this coronavirus than many other viruses which cause illnesses in humans and were detected years ago. It is time we stop giving royalty status to SARS-CoV-2. The world has enough scientific and epidemiological understanding which should be used to respond to the current surge and prepare for the post-pandemic period. The low-income and middle-income countries need to show leadership in bringing the world out of the pandemic. It is very much doable.